All right, so these are the top 5 reasons why people are leaving the pre-health field, pre-med, all that, and going into public health or other fields. I feel like I'm somewhat an expert in this because this is similar to my journey during my freshman year of college. I literally dropped pre-pharmacy and went into public health for a host of reasons. The first one being that we weren't really passionate about science. Now, science is a major part of everything, whether you eat, whether you drive, whether you exercise, whatever. And to be able to go into being a doctor, go into becoming a health care practitioner, that takes a lot of science. And by no means, it wasn't the fact that I couldn't do it or learn it or understand it, because I got A+ in chemistry during my first semester, and I just wasn't really passionate about it. I feel like science looked at humans as just machines, and you just look at them as study biology, the physiology of it, how it interacts with the world and all that. But we didn't really understand the reasons why humans do a certain health behavior, what type of decisions they have to make about their health. And we also tackle on the environmental factors in health, like policy, socioeconomic status, as well as a host of other factors. You know, that's something I became very much more passionate about, and why I went to public health in the first place. If you're a current pre-health or medical school student who are going through science right now and feeling like they have a hard time with it, I'm not telling you you can't do it. I just said it wasn't just for me though. The second reason why a lot of people leave is because people want to look at how community health is impacted from a broader, bigger picture standpoint. Being a nurse, being a doctor, being a healthcare practitioner in any aspect is really cool, because you can really, individually impact patients' lives. But being a public health practitioner, you look at population health from a big picture, systematic standpoint. Whether it be an epidemiologist who is learning the different causes, the barriers, as well as the mitigation efforts for certain diseases, from being a healthcare administrator that looks at an entire department or entire facility and evaluates the performance overall, to even working with politicians as a stakeholder to enact certain laws that promote certain health opportunities in certain populations. There's so many opportunities that you can influence from a public health standpoint that being a doctor or being a healthcare practitioner prevents you from looking at. And I'm not saying that we don't need any more doctors, we don't need no more nurses. We're not saying like practitioners aren't, good at their jobs or whatever. But what I'm saying, we also need great, public health officials and practitioners that are able to have this viewpoint of health, to be able to influence the things that we need to get done outside the clinic. So the next thing, which is a major factor in many people's wallets as well as financial plans, and that is medical school debt. The average cost to attend medical school is $200,000. And that doesn't even tax on the amount of loans you have during your undergrad years. And if you know anything about medical school culture, many students go to these prestigious undergrad, schools, to pay all these exorbitant amount of fees to get the best education, to be able to have a sliver of a chance to get into these medical schools. While I'm saying this isn't the only reason, but we have seen a rise in people to go into NPH programs, so not only because of the passion of going to public health and the need of a better public health workforce, but I'm pretty sure that a lot of people went into NPH because they can't afford medical school. And don't get me wrong, doctors make a lot of money, and I'm pretty sure they're able to pay off this debt. But this is a lot of debt you have to be consumed with, and it will take years and years and years to take care of. And at the end of the day, a lot of people might not be in that situation where they're able to be stuck with that amount of debt. Another thing to keep in mind is that people are pressured into staying in medical school and becoming a doctor even if they don't want to, because if they drop out in the middle of medical school, they will have to pay that debt off otherwise. And there's a lot of other careers that won't be making that much bank to be able to pay off that amount of debt. We can have a whole debate about whether medical school should be free or not, but the fact of the matter is that many people have this on their mind whenever they're thinking about medical school or becoming a doctor or what they want to do after college. And this is the prime reason why a lot of people who are once, thinking about medical school take a gap year and decide to go somewhere else because of the cost. Next factor into why I left the field is the attitude, the arrogance of gunners. Now, I don't know if this is a universal educational term used in all fields. I literally got this off my law school friend. But basically, think of gunners as in Karens, and basically Karens in education are probably the worst Karens you're gonna have to deal with. There's many times during my chemistry and biology class, people will give out false information. I've seen pre-med students hijack study sessions because they really wanted to, prove and stroke their ego that they're the best in the room and not allow other students to really learn. I've been in classes where pre-med students rejected a professor to have a curve, especially on a hard exam, because they didn't want their 98 to go down to 97, and we were already on letter grades, and the highest letter grade we can get was an A, so it wouldn't really affect them regardless. I'm pretty sure everyone know that one student in high school that literally would complain about missing one question on a test, all that. Basically, that's your pre-med student. And by all means, I'm not saying every pre-med student act like this. I've met some pretty dope pre-med students who are in medical school right now doing their thing, you know, getting a degree, whatever, and really some dope people. But I'm gonna tell you this, there are a lot of Karens in pre-med, and that's something you have to be aware of. But these attitudes and this behavior kind of explains this next factor, and that is, I didn't really like the way we look at, you know, the U.S. healthcare system. More people are starting to wake up to this, especially after COVID, but we have a treatment-based system to what health should be, which is a prevention-based system. For example, take big pharma and insurance companies. These are one of the biggest, or two of the biggest booming fields in healthcare. And they bank on the fact that people are going to get injured and people are going to get sick. And instead of preventing people from doing all that, they are just making treatments to like treat the illnesses, as well as they're making insurance plans. A lot of times they're trying to nickel and dime you into paying higher deductibles to them and skimming your benefits. Now take the public health sector, which is ironically seen as a separate sector than what healthcare is. It has less funding, it has less ability for you to get well-paying jobs, less capabilities to be able to track and survey diseases. And for those of you that do not work in public health, there is many public health departments that still run on fax machines. They were run on fax machines during COVID, when, you know, it was spreading like left and right. So just getting in that mindset, we don't have priorities in check when it comes to like health in the US. We rather focus on making money, you know, creating a profit off of that new drug invention, instead of just actually creating things that prevent illness, that prevent disease. A lot of people chalk it up to just human behavior and just leave it at that. But people don't understand that there are many factors that influence human behaviors. Like I said before, policy, you know, environment, socioeconomic status, as well as, you know, capitalism that ties into that. Like there's so many factors of human behavior that, you know, we can influence and shape, but because we have a treatment-based system in the US, we're not going to like look at it from that perspective. And so with that being said, that's just a small rundown why I like many other people, decided to leave the pre-health field and go into public health, because I feel like there needs to be a big culture shift into like how we facilitate health in America. If you like what you see today, please like, subscribe, turn on post notifications, all that wonderful good stuff. If my video has somehow convinced you into going to public health, then watch this video. These are some of the foundational principles that you need to understand to be a good healthcare practitioner. Stay warm, stay frosty, depending on what part of the country you're in, and peace out.